our dear viewers, and welcome to a new edition of our program Africa Today. In today's edition, we are going to shed light about the efforts exerted since 2018 by the Health Ministry to eliminate the waiting lists. The Ministry of Health and Population announced on Thursday that number of expedite surgeries carried out for patients on waiting list has amounted to 1.3 million since the launching of the presidential initiative in 2018. Earlier in 2022, 3 new specialties were added, and those are surgeries of chest congestial defects in children and bone marrow transplantation. The initiative was made possible through assigning some surgeries to hospitals that are not affiliated to the ministry and that signed up to take part in the move. More details in the following story.
Ministry of Health and Population announced that it has paid for 1.7 million surgeries since mid-2018 under a presidential initiative to end waiting lists. A statement by the official spokesman of the ministry, Hossein Abdel Ghaffar, read that the Health Ministry followed up on more than 61,000 cases after the surgeries were performed to ensure the quality of service provided to patients during the period from January to May 2023. The spokesman added that additionally, the ministry received 27,000 calls from waitlist patients during the same period through the dedicated hotline for the initiative. Abdel Ghaffar also said that the services of the presidential initiative are completely free of charge, including surgeries for the heart, bones, tumors, brain and nerves. In March, Sisi directed the Tahya Misr Long Live Egypt Fund to allocate 1 billion Egyptian pounds for the presidential initiative. Egypt launched many health initiatives in recent years, including the 100 Million Health Lives Presidential Initiative, which aims to raise awareness of reproductive health and family planning, and the Egyptian Women's Health Initiative, which seeks to detect cancer at an early stage.
And indeed, over 150,000 surgical operations have been conducted under the presidential initiative dealing with the urgent waiting list for the surgical procedures. To shed more light on the issue, we are very much delighted to be joined over the phone by our dear guest, Dr. Magdy Adly, Senior Manager in the Healthcare and Quality Control Management. Doctor, good afternoon to you, sir.
Good afternoon. My great respect to you and to our dear viewers and to the audience.
Thank you so much for being our guest, Dr. Adly. Dr. President Sisi ordered to finalize the patient waiting lists in all the public health sector hospitals. How far the ministry was able to fulfill this goal so far, Doctor?
Okay, actually, waiting list elimination was one of the greatest initiatives launched by His Excellency Mr. President since 2018, exactly July 2018, and finalized right now more than 1,600,000 urgent and critical surgeries in all modalities, like open heart surgeries, like cerebral catheterization surgeries, like kidney implantation, like liver implantation, like bone marrow implantation in children. These surgeries was a great, in fact, was a great obstacle before for many ministers of health, because these surgeries need a big financial budget. And need some kind of doctors and nurses trained well, even in it needs specific medical supplies. And these initiatives continued even at the time of COVID-19 pandemic, because as I told you, it is a critical surgery and needs a fast and the quick medical intervention. Regardless to the medical cost, because Mr. President, as you know, both the health of citizen on the head of his priorities and his agenda, and at the same time, all these surgeries were for free, totally, on the side of the government. And by the way, I'd like to salute the Tahya Masr Fund, because he looted a lot of these initiatives. And in the same time, it is fast procedure, more than before. For example, now we can see some surgeries like open heart surgeries take only from 15 to 21 days maximally. Before it was taking months or more than. And these surgeries, as I told you, was critical, and measuring the citizen satisfaction, and even Ministry of Health do this side by side, even the private sector, and Mr. President always ensure and emphasize that private sector is supposed to have a share and have a role in these initiatives to avoid accumulation of that waiting list another time.
Yes. Doctor, actually earlier the Director General of the World Health Organization congratulated Egypt on its new universal health insurance law, calling other countries to follow Egypt's example. What's your take on that, Doctor?
Okay. The Director of Manager of WHO call other countries even to follow the example of Egyptian state for applying the law of comprehensive insurance system, which have been applied in Egypt, and they always have a good relationship between Mr. President and even the General Director of WHO, because what they see on the ground, what they see of what Egypt do in the field of health. And by the way, these institutions, global institutions, always looking for the light spot of health worldwide. And of course, that comprehensive insurance system, for example, is one of the light spots in Egypt. And they would like to transfer that experiment to another neighboring countries, even African countries or other Arab world or Mediterranean countries. And if we are talking about comprehensive insurance system, it's not only, we mean a new infrastructure, we mean a new hospital, we mean a continuated medical education for the medical staff. It means a lot, for, not only making providing of good health for the citizens. Also, if we are talking about the comprehensive insurance system, Mr. President, from the beginning, it was planned to be applied for 15 years or a year. According to the advice of a global consulting office. And the advice was it takes 15 years to be applied nationwide. But for a second time, Mr. President gave his order to shortening that period of time to be 10 years or 10 years only or less. And now it takes place in 6 governorate nation, and inshallah by 2018, it will be applied nationwide and cover all the states. And we supposed to know, as I told you, it's that system is a new infrastructure, it's a new hospital, a new medical apparatus according to the recent global technology. And in the same time, Egyptian citizens won't pay a lot anymore for medication, and country and government will lose or share the greatest part of that cost. Also, Mr. President, as I told you, call the private sector to have a share in health field to be side by side with the governmental sector.
Yes.
And he usually do his best for the Egyptian state health, and even he is sharing with even to transfer that healthcare services to our brother of African countries for sure.
Yes, indeed. Doctor, what actually is the significance of this new health insurance system, and why the head of state is actually keen to improve the Egyptian people's health?
As I told you, that a comprehensive insurance system is a good a good example for what the government and health and the Ministry of Health does. Because you know that system that includes all the medical care services needed for the citizen in a good and qualified service. So the citizen will have good and qualified medical services, regardless to the payment, because as I told you, the big share will be on the side of the country, and that system. Many countries, by the way, take a lot of years to apply that system, because it's not an easy job, by the way. Even an advanced countries like USA, for example, take a long time to apply that kind of comprehensive insurance system for their citizens. So if we manage to make it nationwide, so we will succeed. Of course, we will succeed, and then we can transfer the experiment to our, as I told you, to our neighboring Arab countries or to our neighboring African countries and all the African continents, by the way.
Yes. Sir, how did the new system address the challenges facing the health sector?
You mean that comprehensive insurance system, or which system is it?
Yes, the health system.
Health system in general. Look, a health system in general, we are apart from that world, and we are affected by the external conditions from that global war or something like that. So all the countries are suffering nowadays from supplying by medical, even supplied or medication, and so that our president usually said we would like to transfer or localize the manufacturing of medication or manufacturing of medical supply. So these is the biggest, maybe the biggest challenge for the Ministry of Health to collect and to have the medical supplies and medication and transfer the technology of manufacturing of medication here in Egypt even also the human element for improving the medical education by continuing the medical education to be side by side with the recent studies of global studies.
Yes.
So if we have an international medical education and we have enough medication and medical supplies, so there is no problem because we have already made the infrastructure of
Yes.
hospitals and according to the global or recent guidelines of WHO. And we have a lot of steps in the field of health and eliminate almost 70% of the biggest problems of the medical field indeed.
Yes, indeed. Actually, Doctor, one of the most remarkable medical initiatives by the President is the 100 million healthy lives. How do you assess the success of this campaign?
For another time, we insist that a presidential initiative was a greatest solution for some challenge in the field of health. So 1 million initiative was one of these great campaigns launched by His Excellency for early diagnosis of hepatitis C, for example, and currently diseases like hypertension, obesity, and diabetes. And these, by the way, these diseases considered the main reason for like 70% of mortality annually. And early discovering and the treatment of hepatitis C was a great challenge indeed, because Egypt was recorded as a pandemic area or having a lot of cases of hepatitis C. And now, alhamdulillah, we are closely free from hepatitis C through that great effort from His Excellency and government. And that was a great feedback for the international income and GDP. And Egyptian prison health and Egyptian public health in general.
Indeed, Dr. Magdy Adly, Senior Manager in the Healthcare and Quality Control Management. Thank you so much for your very precious input, sir. Meanwhile, the UN High Commissioner for Refugees, Filippo Grandi, remarked that Egypt plays a crucial regional and global role in hosting the significant number of refugees of many nationalities who fled the instability in Sudan. Up to 300,000 Sudanese people are expected to cross the Egyptian border and will need humanitarian assistance. Local teams note that between 20 to 25% of the refugees are persons with disabilities. More details.
United Nations High Commissioner for Refugees Filippo Grandi said during a meeting with President Abdel Fattah el-Sisi that Egypt plays a central regional and international role in hosting large numbers of refugees of different nationalities who fled the Sudanese conflict. According to spokesperson for the presidency, Ahmed Fahmy, Grandi expressed his appreciation for Egypt's intensive efforts towards settling the crisis and restoring security and stability in Sudan. He also affirmed his keenness to enhance cooperation in supporting displaced people hosted in Egypt. The UNHCR chief had inspected the Egyptian-Sudanese border crossings on Sunday to ensure that Sudanese refugees were provided the adequate support from UN Egypt teams. Grandi hailed Egypt's efforts with UN organizations and the Egyptian Red Crescent to help Sudanese and other refugees escape the war in Egypt's southern neighbor. He retweeted that the international community, as well as donors, must provide support to hosting countries. Sisi affirmed the refugees issue and all forms of displacement should be dealt with a comprehensive approach. Sisi added that this approach is meant to address the roots of conflict and achieve security, political stability, and inclusive sustainable development.
With this, our dear viewers, we come to the end of our program Africa Today. But we leave you with this report where the first full day in power of Nigeria's new president has been people panic buying fuel following his decision to scrap a decade-long subsidy on the petroleum products. In Monday's inaugural address, Bola Tinubu said that the subsidy was gone. More details follow, and thank you for watching.
Nigeria is grappling with fuel shortages as waiting queues have started forming at filling stations across major cities. This comes a day after Nigerian President Bola Tinubu announced the removal of fuel subsidies in his inauguration speech on Monday. According to local news reports, most filling stations were closed while others that were opened were selling above the approved pump price with a long queue of customers. Earlier in the morning, before the news of the removal went around, the filling stations were selling at their different rates, but some closed down while others increased their prices by evening. While the state oil company insists there is sufficient fuel supply and advises against panic buying, some Nigerians have expressed frustration about the scarcity. In his inaugural speech, Nigerian president explained that the fuel subsidy was scrapped due to allocations, emphasizing that the system benefited the wealthy and had become increasingly costly to maintain. Local media reported that one of the major petroleum marketing associations has come out to say it does not support President Tinubu's plan. It said the new government would begin a dialogue before taking the decision.